activities for at least 4 weeks. No major shopping, no major cooking, but you can go to back to your normal day-to-day activities. The same thing with the radio frequency. There is the technology, again, it stimulates healing, but the process in both cases can take 12 to 16 weeks. So it's not like surgery where you're healing. It's actually a process that gets started, and it takes time for the tissue to heal.
So go into a little bit more detail about the Topaz, the radio frequency one, because that does involve it's minimally invasive.
Yeah, that can be done a couple different ways. It can either be done where the skin is opened and the tissue is exposed, as in traditional surgery, or it can be done what we call percutaneous, meaning under the skin.
Okay.
And the way I do it is through multiple holes. It sounds awful, holes, but multiple holes placed, very small holes placed into the tissue from the skin, and the energy is delivered through what's called a wand. It's a
device.
A device.
Pen,
exactly.
It's like a pen shape.
Exactly, and it goes straight through the small holes, and depending on the area that's painful, you may have 20 to 30 holes.
Okay.
But they're small, and it doesn't require sutures. It heals pretty quickly.
Local anesthetic is used sometimes to deaden the pain?
Yeah, or your doctor may decide to use anesthesia through an IV so that you don't feel the injection. The injections in the bottom of the foot or the heel to numb up the heel, it can be painful.
Yeah, sure.
So usually for patients' comfort, people do it with some IV sedation.
Yeah. And again, these are procedures that are done after conservative methods don't work.
Absolutely.
So we don't want to give people the impression these are first line treatments.
And even with when Shockwave first came out, it was FDA approved, I believe in 2001 for the United States, and there were definite guidelines. You had to have pain for 6 months before it could actually be used.
Right.
And I don't think they really knew why it worked. I don't think they knew exactly the difference between long-term pain and short-term pain. And as a user, it wasn't clear to me why it was different and why it worked differently. But the more I learn about, and the more we in general learn about the body and about differences in tissue, and when the radiofrequency technology came up, it was much clearer why both of them worked. It was to stimulate healing, to stimulate blood flow to the area.
What has your experience been with the patients on both procedures in terms of their long-term recovery? If a patient comes in today, for instance, and gets the procedure, when can they anticipate being back to normal activities, pain-free?
Yeah, what I'm finding is probably 95% of the patients are 95% better. And I don't want to say 100% better. I like to have that give, but probably 93 to 95% patients are drastically better. Really, their lives are changed. And the first 2 weeks, you're taking it easy. You can be on your feet. I keep my patients off 2 days, any surgery. They're off 2 days, and they're doing nothing. They're resting. They're elevating. And then gradually you can get back to your activities, your day-to-day activities.
Do they wear a boot or a special shoe at all?
Yeah, they wear a special shoe for a short time, and then they go into a tennis shoe. And again, it depends on the patient, but generally 2 weeks is the time where you're really favoring it and babying it, and after that you can be back to your normal activities.
Now with both Shockwave and Topaz, do patients typically require multiple treatments? Do they have to come back, or is it usually one treatment and then that's effective?
The radiofrequency or Topaz is geared as a one-time treatment, and I've had instances with both actually where the main part of the pain is identified and treated, and suddenly they have pain in another area, and the fascia attaches all the way along the entire bottom of the heel.
Right.
So they may be most painful on one spot, which gets treated, and then they may start to have pain on the other side. And I don't think that the pain or the problem migrates. I think it's actually that this was such a problem that they didn't realize this was a problem. So that's happened before where they've needed another treatment for that.
Yeah. But
the radiofrequency is really a one-time treatment. And again, the Shockwave, depending on the type of unit, can be either a one-time treatment or multiple treatments.
Okay. Well, we've only got about a minute and a half to go in the show, so let's do a little wrapping up here. We started the show talking about general kinds of healings and go over for the viewers, again, people that might not have tuned in at the beginning, some general treatments and general kinds of things people can do, maybe at home. Do you recommend ice for this or heat? People are always asking us about cold versus hot.
Ice is always good. I have no problem with ice at any time. Ice treats inflammation. The problem with heat is that it can increase inflammation. But the things to do at home for heel pain is to wear shoes. Don't go barefoot. Don't wear slippers. Wear shoes that have a firm grip around the heel, and stretch your Achilles tendon and stretch out the foot. And that really helps a lot of people a lot of time. And the important thing to remember is foot pain is never normal.
Right. People shouldn't be walking around with that for 21 years, like you mentioned before. Yeah. They should really get in to see a podiatrist as soon as possible for a thorough evaluation. And Dr. Reed, thank you for coming on.
My pleasure.
Feed Forward. Again, we'll put up the website again. For referral to a podiatrist in Illinois or Chicago, you can go to our website, which is right up there. There's also a toll-free number that you can call and get a referral to a podiatrist in a zip code near you. We certainly encourage you to do that. And also, don't forget, if you want to see any previous episodes of Feed Forward, you can do a little search on YouTube, type in IPMA, and you'll get to see all of our greatest hits from the past shows, including this one, pretty soon, let's hope. All right, we'll see you next month. Thanks a lot, and have a good night.